Hello, my name is Pam Brown and I'm from the Rotary Club of Melbourne. I'm here to talk to you about a project that we have just embarked on, the Trauma Recovery Network, which we call Healing the Hurt. The way we heal hurt with trauma is by using a therapy called eye movement desensitization and reprocessing. This therapy was developed 30 years ago and has undergone enormous amounts of research and is evidence-based. It has shown to actually heal people who have the symptoms of trauma and reduce the incidence of PTSD and mental health in people who've been affected by disasters. It's recognized by the World Health Organization, the Department of Defense, and it is recognized by Medicare Australia, particularly in the treatment of trauma from the recent bushfires. We started working with this therapy to meet the need of children who've been affected by trauma. We had a family violence committee, and we were looking at a way to help children who've been exposed to family violence. I had been working in this area for a long time as a psychologist and someone who specialized in trauma. I knew that there was treatment for children, but it wasn't often used in the community. So we decided to use our funding to teach therapists who actually work with children exposed to family violence how to treat the trauma. We invited Dr. Sarah Schubert from Perth, who is an expert in trauma and children, and we trained 33 therapists from 12 agencies across Melbourne on how to treat children and their families. Recently, in 2019, Sarah came back and she and I together trained 18 therapists at the Gatehouse Center Against Child Sexual Assault located at the Royal Children's Hospital. In 2018, Dr. Derek Farrell from the United Kingdom and an expert in treating trauma in disaster areas trained 18 therapists who work at Foundation House, which is the Victorian Survivors of Torture and Trauma, in how to use it with refugees who had been victims of torture and trauma. And in 2020, Derek came back to us, and from his enormous amount of experience working in disasters throughout the world, helped us design our own bushfire recovery network so that we could treat people who've been affected by disasters. And now we have established our trauma recovery network in Australia. We are just beginning to recruit therapists from around Australia who, in these times after COVID-19, are now able to do telehealth. So anyone from around Australia can help with our project. We will ask them with their expertise in treating trauma to help us work directly with those people in the bushfires who do not have access to proper professional trauma counseling. We also plan to begin training people who live and work in those areas that are therapists or mental health nurses to deal with trauma and help the communities build their own capacity for future need. We are hoping to involve Rotary clubs from throughout the disaster areas to help us provide information, to support us when we come to do the trainings, and to help build the capacity and their understanding of trauma. So please join us if you would like to find out more by going to our website at the Trauma Recovery Network.